So how exactly does it work? If people go on your website, you can see a wand being, going over the body. Is there a frequency that comes from that? And talk about the safety of that, because I'm sure that's a question that you get.
Okay, well, Ondamed is, first of all, to answer your last question first, is absolutely non-invasive. So even my son, that was such a concern for me when I first got into this area of integrative complementary medicine, is would it be safe to use Ondamed stimulation on my son who has a pacemaker? So I did take the device down to Westchester Medical Center to have him on the echocardiogram. Cardiologists observed, the Medtronic people observed, looking at the pacemaker output functions while I was running the frequencies into my 5-year-old son. It was almost 13 years ago. And there was no interaction. Couldn't be, because we never exceed of what our own cells, of what our muscles would produce in terms of electricity when we twitch the muscle, when we, what's it called?
Flex.
Flex it, is that a good word?
Sure.
When we flex the muscle. So that was important to me. So we have no contraindications, even implants, the pacemakers, any electronic battery, so to speak, in the body is safe to use. So you can use it on babies and on older people, on animals. It is the stuff that we are made out of.
So talk about what you're finding when you get a specific reading over a certain part of the body. What does that indicate to you?
So it would indicate that there is a dysfunction. And the dysfunction could be on a skin level, bone, ligament, tendon. We don't know exactly what it is. So our approach is a non-labeling approach. What our interest is to find the area. And that area most likely will be inflamed, infected, traumatized. There may be a scar tissue there, or there may be a unresolved memory of shock or trauma. So we can't pinpoint what it is. But as we stimulate, the patient will most of the time let us know that there is a problem there that they haven't thought about in 30 years. And amazing that we were able to identify it, because we have those little issues, inflammatory processes brewing in our bodies all the time. And it may be an acute one, but often, of course, it is a chronic one that we're schlepping along all of our lives. An unresolved football injury could sit, or, I don't feel it, it doesn't mean it's not there. And how would you find it? There's no device on the planet that would allow you to tap in and find a dysfunction that you don't have a symptom for. Sure. So that is difficult. And to your earlier question, how do we start all this, right? The patient sits down, we place a neck applicator on them, and then we run through frequencies. There's a device sitting to the right of the practitioner, and you run through like an old dial phone. You're dialing through frequencies while palpating the radial pulse of the patient. So the stimulation is coming out of the neck applicator, pulsed electromagnetic fields, and I'm running through about 400 different frequencies ranging from 0.1 to 32,000 hertz. I could use any of them, but it's a much better idea to use what the patient needs at this time. So anytime I feel a reaction from the pulse, so I palpate the pulse, anytime I feel a strengthening of the pulse amplitude, I know that is a frequency that is of value to the patient. So I lock it in. So I find maybe 8 different frequencies until I have gone through the whole span of frequencies, go back into that sub-memory to select the most significant one for the right channel of the applicator, and then I do the same on the left side. So I have 2 frequencies. I adjust the intensity. What's the dosage? How loud does the body want to listen to the frequencies? And then I add a handheld applicator. That's the one that you're talking about. While the neck applicator is still stimulating on a systemic basis, then I feel the patient's pulse and I scan the body while already being in treatment mode. Anytime there are frequencies coming out of the Ondamed applicators we treat, we stimulate tissue. Tissue is a combination of cells, and electromagnetic fields go all the way through. So it doesn't stop unless you have an implant or pacemaker. Then of course there's a metal in the way. But that's very unique, because that is the stuff that we're made out of. We're electromagnetic beings. The body will take that information in. It's like tapping into the communication of the cellular pathways, the cellular communication networks. So that's the first module. And that first module with the individual frequencies, that would be giving us the information which organs and organ systems are in the forefront, could possibly be not as effectively working as they should. That is a grid, based on Pythagoras' mathematical structures and music, a tempered piano. It's a frequency list that also represents colors, and any activation column in the chart would point to a specific organ or organ system. So you have heart, small intestine, liver, gallbladder, and this is a mixture of Western and Eastern philosophies. So my husband, who invented the device about 20 years ago, he looked through the peer-reviewed literature. He also, from his experience of what he has seen and done over his previous work, about 20 years going back, it prompted him to not stick to one paradigm, to just combine it. So if a traditional Chinese medicine physician would look at that chart, they would say, oh, that's not quite the color that matches this organ. And a traditionally a Western medical professional would probably see it from a whole other perspective. And then we have another 3 modules where, again, I would identify which program in the second module, 174 different programs. Again, I bring the patient, I run them through the 174 programs. I listen to them by feeling the reaction through their pulse intensity. And then these programs are like symphonies. They are combinations of frequencies that have been found to help people that have had, for example, hip joint pain, insomnia. They have, maybe they're not self-accepting themselves, so there's some emotionally driven programs. The joy of life, there's a detoxification, there's organ-related and brain-related waves, combinations. It's like a huge menu. It's like going to the restaurant and saying, well, what do I want today? Oh, that chicken talks to me. And then finding that stimulation, we would then place the applicators to where we receive those reactions and stimulating focus to the areas of where the pulse responded. So if you have a reaction on, let's say, your liver gallbladder region, and you have a reaction on your right knee and your left shoulder, well, we would be placing up to 4 applicators on those regions.
So Ondamed's not just a diagnostic tool, it's a treatment tool as well, correct?
It is primarily a treatment tool. And I wouldn't say diagnostic, because that's a big no-no, and it also doesn't really fit the allopathic diagnosis. We call it a diagnostic perspective. It gives us an additional view on the patient, which is zooming out wider. We can't tell you if you have fibromyalgia or rheumatoid arthritis. That's up to the clinician to take a look at the clinical picture. But the trend in the patient, the programs that show up, the frequencies that show up, will indicate that maybe sometimes something is going on with the kidney. And because the kidney responded when I scanned you, there's a kidney-related frequency, programs correlating to bladder and kidney. So while you didn't have, you didn't come to me to be looked at from a kidney aspect, you came to me because you have insomnia and migraine headaches. But because the Ondamed revealed the kidney, well, I'm going to do further lab tests and see if something is off there. And I will ask the patient, do you have any pain? Did you have ever any issues with your bladder or kidney? You wouldn't ask such questions had you not had the chance to put them on the Ondamed and then scan them through and find those areas. So it's pretty profound in aiding to the regular diagnosis.